Hello. Fragile X syndrome is a genetic condition and it causes intellectual disability or learning disability as it's previously been known and other medical conditions. It is the second commonest cause of intellectual disability, the first being Down syndrome, and it is the most common form of intellectual disability that is inherited. It is inherited through the X chromosome, and as boys only have one X chromosome, they are more severely affected. As girls have two X chromosomes, and usually only one X chromosome is affected, 2/3 of girls do not have an intellectual disability. Fragile X syndrome affects 1 in 4,000 girls and 1 in 8,000 boys. It was first described by Martin and Bell in 1943. It is named because of the unusual shape of the X chromosome seen in particular laboratory tests. It is caused by a mutation in the FMR1 gene, and instead of about 5 to 40 repeats of the DNA segment CCG, in Fragile X syndrome there are more than 200 repeats. This causes the FMR1 gene to be deactivated and thus not make a protein, and the lack of this protein causes the symptoms of Fragile X syndrome. A person with Fragile X syndrome has problems with cognitive development, and as well as an intellectual disability, they may have problems with attention and concentration, be hyperactive, and have difficulties with language and in social situations. Some people with Fragile X syndrome have symptoms similar to autism, including lack of eye contact, wanting to have the same routines, anxiety in social situations, speech and language delay, communication difficulties, and hand flapping or nail biting. Up to 50% of males and 15% of females have autism as a second diagnosis. The intellectual disability in Fragile X syndrome can be mild, moderate or severe, but it is rare for somebody with Fragile X syndrome to have severe intellectual disability. Some people with Fragile X syndrome may not have any noticeable symptoms. As for physical difficulties, some people with Fragile X syndrome have problems with connective tissue and may have flat feet, be hyperflexible, have low tone, mitral valve prolapse in the heart, difficulty breastfeeding, and recurrent ear infections. Some children and adults develop epilepsy. Most people with Fragile X syndrome do not have any particular behavioural syndromes or physical characteristics, and thus diagnosis may often be delayed. The diagnosis is made on genetic testing. However, some individuals with Fragile X syndrome have a long, thin face and prominent jaw and ears. It is possible to test people if they are a carrier of the Fragile X syndrome gene, and also to test prenatally. Thank you for listening. Bye for now.